it's provided by your employer or some other entity. I understand that very well that there are a big problem, and I'm sure it's here too, with people who have the, quote, chronic disease situation and chronic health problems. I think that we've got to create some kind of risk adjustment bonus for Medicaid to high-cost and low-income families to supplement tax credits and Medicaid funds. We all know that there are people who are, quote, uninsurables, and they deserve health care as well. And if we developed a financial risk adjustment bonus to help care for those people's needs, I think it's important for us to do so. I think we ought to encourage health insurance policies and companies and corporations to encourage wellness and to reward wellness. If someone stays well and fit, they ought to have either a cash back or they ought to have reduced cost for their health insurance. My friends, Americans are becoming less healthy because of our habits. Obesity, as you know, is a huge problem. There is a rise in diabetes in America. We've got to, at an educational level, at the school level, at an insurance policy level, and an adult level, we have to encourage wellness and fitness in America. That's the only way we're really going to attack some of these chronic diseases such as diabetes. And that should be taken on, I think. If we can educate young people not to smoke, and I think we've made some progress there, can't we encourage young people to have a healthy diet? Can't we teach them in the schools the problems associated with obesity or the wrong kinds of diets and encourage exercise and participation in athletics? I think that that's a big item. And I think that we as a country can do a lot better job than we've been doing in the past. That's got to do with personal responsibility. So with all of that, and I know it's big doses, and I know some of it's controversial to you, maybe I can say thank you for your care, thank you for your concern, thank you for your love for people who need your help every single day and get it still the best health care and the best medical care in the world right here in the United States of America and right here in the heartland. Thank you for letting me speak, and thank you for being here, and I'd like to respond to any questions or comments or insults that you might have. Thank you very much. So maybe, yes, ma'am. And I'll just move down this way. Where's my guy, Dan Crippen? Is he around here? Yes, ma'am. Go ahead.
Thank you for addressing both the health crisis as well as the health care crisis that we've got going on. Do you have any thoughts about where you stand as far as tobacco subsidies for farm, some of the advertising for food choices, any of those kind of things that are certainly contributing to that?
Thank you for bringing that up, because the S-chip, as you know, was proposed to be expanded by some $35 billion. Do you know that the way that they want to pay for it? They want to pay for that expansion of the S-chip program with $1 a pack increase in a tax on a pack of cigarettes. In other words, we want people to smoke. We want children to smoke so we can care for children. Please. I mean, it's the worst kind of thing. And now we are seeing, at least in some areas of America, an increase back in tobacco use. By the way, that is also directly related to the failure to use that tobacco tax money for prevention and education programs. They're now pumping it just into the general budget instead of using. When we were spending that money on educating children and young people on the evils of smoking, we were making reductions. When they stopped that, then we saw a difference in the trend. Yes, I think that tobacco subsidies are a disgrace, an absolute disgrace, and I have opposed them forever. And by the way, we have done, in all fairness, we've done away with most of the tobacco subsidies. But I am deeply disappointed in this multi-billion-dollar deals that was made between the tobacco companies and the attorneys generals, where some lawyers made literally billions of dollars, not millions, hundreds of millions, billions of dollars, and the commitment was, we'll take this tax on cigarettes and we'll put it into two things. One, education programs and treatment of tobacco-related diseases. There's hardly a state in America today, and I don't know about Iowa. I don't know. But there's hardly a state in America where that money is going to those stated purposes, which when the attorneys generals made that agreement with the tobacco companies. And so we should be more than angry about it. Yes. Sir, Terry.
Senator, one of the things that particularly hits us in this community and in this hospital is the kind of patchwork quilt of Band-Aids and fingers in the dike that have tried to buoy up the Medicare program. So this hospital is affectionately referred to as a tweener hospital. We're between the critical access hospital program, the program for small hospitals, and the rural referral centers and some of the urban payments. So just to give you some context for that, in Iowa, there's a little over 80 hospitals that are in that critical access hospital program, which has been hugely beneficial to rural health care in America. And it literally pays the cost, 100% of the costs of caring for Medicare and Medicaid, because Medicaid often follows the Medicare and Medicaid in communities that have hospitals with 25 beds or smaller. As you get to slightly larger communities, hospitals referred to as rural referral centers, they get a little bit better payment program as well because they have some special burdens of meeting a regional need for health care. And then you get into urban areas, some of those reimbursements are not so good, but they also have smaller concentrations of Medicare patients, so they can shift the costs when they lose money for Medicare. This hospital doesn't have any of those special programs. There's 8 hospitals in Iowa like this one. We last year got paid 63% of what we actually spent, not our charges, but what we actually spent taking care of Medicare and Medicaid patients. In the country, the average hospital gets about 92% of its costs. So some of the smaller ones get 100%, and then you could literally argue this hospital is the worst paid hospital in the country, because Iowa traditionally is at the lowest end when you look at per capita government spending on the Medicare program. Where the upper Midwest in general is at the bottom end, but Iowa's been either 49th or 50th for quite a few years, and we're at the lowest end of Iowa payment. So you can mathematically look at it. Now the other interesting thing is our hospital payment is about our hospital costs are about 30% below the national average. So it's not that we're overspending, it's not that we're expensive, it's just based on all these different formulas and things that have happened. So in 2000, we got paid about $500,000 less than we spent taking care of Medicare and Medicaid patients. Just last year, just 6 years later, we got paid $8 million less than we spent taking care of the community members that are in those programs. On a $40 or $50 million budget, we can't make up $8 million. So we'll lose $1 million, maybe $1.5 million this year. Fortunately, we've got a community that's been dramatically supportive. I mean, we get a philanthropic support, and people see that it's an important, vital community resource, this hospital. But if we don't see some changes, and absolutely, I think most people recognize we've got a tsunami coming in terms of how to care for Medicare patients when boomers start to retire, and the most recent numbers I saw, 2013 is when Medicare goes belly up. So we've got a huge tsunami. We've got a problem right now, just being able to meet the next year or 2 years. And so we've got a particular challenge, especially with PAYGO and where we are. We've got a good senator from the state that's a colleague of yours, Chuck Grassley, who's been involved with this in terms of the Senate Finance Committee and worked with him. And he's looked at some formula tweaks that we can get a little Band-Aid to help. But there's about 300 hospitals nationwide. There's a few in your state that are in our same category. And so I'm just curious if you have any thoughts about how do we make it from here to when we really start to look at reshaping Medicare, where there is more personal responsibility, and we do some tort reform, and we look at preventive care, and and some of the rest. Thank you.
Well, thank you. First of all, and I don't mean to be simplistic at all, but if you've got double-digit inflation in Medicare and Medicaid and health care in America, everybody's going to go under. You're just going to go under first. And so that's why it calls for, I think, fundamental restructuring. I'd like for you to be able to, when someone comes to this hospital,